So, good afternoon. My name is Lisa, and I'll be the moderator for today's event, Trends of Tomorrow, the Future of Health. I'm really excited to introduce all of our panelists, Diana, Nirav, Samuel, and Ashish. Diana is passionate about the intersection of healthcare innovation and finance, and is currently a finance and strategy associate with Gentech. She also works at multiple healthcare startups to develop growth strategy and refine their business models. Nirav is the founder and CEO at Sonova. He is passionate about reinventing healthcare for self-funded employers and enabling better healthcare experiences and outcomes. Samuel leads innovation and venture at Yale New Haven Health. He is dedicated to improving healthcare delivery, expanding the continuum and access to quality care, and supporting new discoveries through market and to patients. Ashish is a healthcare technology veteran and currently leads the Dana team. He is passionate about empowering home and family caregivers with the tools they need to help people age in place. So those are our panelists for today. I want to thank you all again for joining us. We're really excited to hear each of your perspectives on healthcare and healthcare innovation. So to start, can each of you briefly introduce yourselves?
Kate, why don't you lead us off?
Sure. I'm Kate Woolen. I'm a behavioral epidemiologist by training and left academic medical research in 2014 to launch a digital weight management startup. We were a companion solution to a weight loss drug before selling to Anthem in 2014. And now I work with everything from startups to large publicly traded companies on their using behavioral science to support their product strategy and execution.
I can go next. My day-to-day is to build a new venture. Carium was my previous healthcare startup, which is up and running, and that is designed as a virtual care delivery platform. As Lisa introduced earlier, I'm now at Savona, where I'm redesigning healthcare for employers, and with the aim of driving better engagement and obviously reducing the total cost of care. So glad to be here and looking forward to the conversation.
Hi there, my name is Donna Sun, and I'm currently a senior associate at OCA Ventures, which is an early stage venture capital firm based out of Chicago. Previously, I actually just wrapped up my role as a finance manager at a firm out in the West Coast area. And for that, did several years of healthcare consulting at Accenture, and then was involved with a couple different accelerators and early stage startups also in the healthcare space. Really excited to be here and happy to share some different perspectives on the state of innovation and also healthcare investing overall.
Hi, my name is Sam Lee. I'm an innovation lead here at Yale New Haven Health System. Yale New Haven Health is the largest health system in the state of Connecticut. We have 5 hospitals and 2,409 beds, but really focused on advancing research and building a culture of innovation here at Yale New Haven Health. Prior to joining the system, I had the chance to work at Matter, which is a healthcare incubator in the city of Chicago. So it's good to sort of see some of my old friends here on this panel. And Lisa, thanks for the invitation and organizing.
Hi, I'm Ashish Shah, the CEO and co-founder of Dina. We're a company focused on helping the industry transition to both virtual and in-home care, with a strong emphasis on that in-home care component. Prior to Dina, I was the CTO and head of product for a business called Medicity, which was the market leader for healthcare interoperability that ultimately was acquired by Aetna in January of 2011. Just really appreciate the opportunity to be here. And Lisa, thanks again for organizing, and to all the other panelists. Really excited for today's discussion.
Absolutely. Thank you again to all of you for joining us. And so all of you obviously work in healthcare. So my first question to all of you is, why healthcare, and what initially sparked your interest in the industry? Anyone can feel free to hop in.
I'm happy to get it started. I think for me, just in terms of my own personal journey, I did not start in healthcare. I was a computer engineering major for my undergrad, and I worked in product development at places like Microsoft and others. But post September 11th, I sort of tripped into healthcare, and that's where I really saw that, the concept of staying healthy on your terms is something that I think everyone aspires for, but it's complicated. It is a very involved industry, and the deeper and deeper I dug into it, there was a massive opportunity to be able to contribute and do well by doing good. And so I think in terms of my own personal interest and in terms of aligning myself with the work in an industry that can really use a lot of technology, innovation, and other sort of creative thinking, it was an opportunity to sort of really invest a life's work into something that I think that could really make a meaningful difference.
I would say for many of us, myself included, healthcare is a very personal decision, in addition to there being a lot of opportunity in the market. For myself, actually, when I was a kid, so I was born in Shanghai, China, and my parents actually went to the States for grad school when I was very young. So my grandparents effectively were my second parents when they raised me. My grandfather suffered from glaucoma, and even as a young kid, it was so sad and disheartening to see him gradually lose the vision in his eyes. He was the headmaster of a school, so his passion and one of his main reasons for living is engaging with students, teaching them, reading, doing calligraphy, all of that. And of course, when you lose your vision over time, that becomes a lot harder to do. So I was very personally motivated to do something in the healthcare space because I didn't want to have to see people around me suffer like that and feel so helpless about it. So that was my main motivation for getting started to healthcare from a more personal perspective.
I can go next. So my background is maybe Ashish's, where my education is both my undergrad and master's were in engineering. And coming out of school, I spent a lot of years working on that, and then eventually wrote software for many years. And about a few startups later, about 3 years ago, I was between roles and decided that building routing and switching equipment was interesting, but not fulfilling, because even though we enable, I always tell the story like this, that look, like I enable grandma to watch the funny cat video, but I never get to see grandma watch the funny cat video, right? And get the joy out of it. And so I wanted to do something where I could get closer to the people that were benefiting in some way from the technology, and what better way than to go put it in the hands of providers and patients. And that was kind of my pivot. So I've been in healthcare about 3 years, and I got to meet Sam very early in my journey, and he can probably share some scary stories about my early days of what I didn't know, but happy to be here. And I really enjoy the space. So it's easy to find inspiration in your day-to-day work.
I mean, I don't recall a time where I didn't want to be in healthcare. Like loved those science classes as a high school student. But as someone who, did not grow up in a big city, I thought the options available to me were doctor or nurse. And college really opened my eyes to a broader set of things within healthcare. And so decided to pursue public health pretty, right out of college and stayed in that. But I think the thing that's been really interesting for me the longer I'm in this space is realizing how broad healthcare is, and how many different ways you can have an impact on the healthcare system. And spent a lot of time hanging out with Sam at Matter. And as someone whose work focuses on the patient and the provider, it was fun to be at Matter and realize that there were companies working in supply chain and logistics, and having, enormous opportunity to have impact there. And so I think to the earlier points about wanting to do good in the world, healthcare is just a space where, it intersects with so many other disciplines and skill sets that I really like the way she's kind of framed it there as an opportunity to do good with any skill set that you have. And I think that's what keeps me in healthcare.
Yeah, from my experience, I think it's more similar to Donna. I think that healthcare is very personal, and so healthcare is such a big problem, and I think that all of us have to encounter the healthcare system at one time. So, growing up, I grew up in a family of doctors, and I thought that was really the route for me. And in college, is almost predestined to become a doctor. So, made my way through organic chemistry and physical chemistry, all of the above. But really, really by happenstance, I was just about to start grad school, and then my former boss, who was at Matter, this is a shared experience between 4 of the panelists. She just kind of opened my eyes and said, healthcare is going to change dramatically over the next 10 years. And I didn't know what she meant at that time. And so when I first joined Matter, it just really opened my eyes to that healthcare is a business. Healthcare, there's room for opportunity, innovation, and just really by borrowing the expertise and the wisdom of a lot of the entrepreneurs I worked with, I just kind of fell in love, and I just pushed grad school back and back and back. And 6 years later, I'm still in healthcare innovation, and I feel like I really fell in love with this career. But really, the opportunity to take something that's an idea or a concept and build a business around it, I think that's really fascinating and a little bit messy at times, but really opportunity for us to change and create the future that we want to here in healthcare. So that's a lot of my motivations.
Awesome. Thank you all for sharing. So all of you kind of work, I feel like, within kind of different spaces within healthcare. It's obviously a massive industry. So I'd love to hear more about each of your current roles and kind of what your average day-to-day looks like. I'm sure across the 5 of you, it's very different and varies a lot. So I'd love to hear more about that.
Take the pressure off of Ashish and start this time. I split my time between a few different roles. So right now I spend about a day a week mentoring healthcare entrepreneurs up at North Business School. So it is a fellowship program that they do on top of all of their other work. So like Sam, the messiness of that is really fun for me, and then I spend time, helping a very large established company on a new product launch that they're working on. And so that has a different kind of messiness, and that there's a lot of bureaucracy sometimes in a large organization, and that forces your creativity in a different way to work within the constraints that they have, which is fun. And then I'm getting to help launch a new venture in digital therapeutics. So I get to kind of split my time between those things. And digital therapeutics is an area that gets a lot of people excited, but there is no roadmap right now for success. And so I think, like Sam said, there's a little bit of opportunity in the messiness in each of them. And if you can embrace the mess, there's a lot of opportunity to have impact.
Yeah, I can go next. My day-to-day changes a lot, but I will say just in the environment that we're in because of the pandemic, a lot of our innovation projects here at the system had to stop or be paused. And so at that time, it was really sort of all hands on deck. It was really busy both last year in hospital land. So really, it was great for me just to, selfishly and personally, in terms of my growth, to see how the business of healthcare and care delivery, and sort of skipping in and out of sort of supply chain and telehealth. But we're really just starting to pick back our innovation work, and primarily our innovation work. And what I do is to just really organize the way that this health system works with early stage companies. So how can we really sort of find the best entrepreneurs and really sort of surround them with sort of the operational and the system know-how, as well as the clinical expertise to grow their business. So all of our innovation projects are aligned with our system multi-year strategy. But my day-to-day is really meeting with founders every single day, doing some level of project management, making sure that the projects that we have are sort of have everything that they need. as well as sort of, I manage a venture capital fund. So it's an interesting time for digital health. There's a lot of capital pouring in, but I think at this point, we're trying to take a step back and see what's signal, what's noise, and what's here to stay. So I know that we'll get into it, but the day-to-day has changed, but I think that really makes my life interesting. My favorite part is to talk to entrepreneurs and also our doctors and our nurses that here at the system have really great ideas, and helping them sort of incubate their idea and help them really just take the first step to moving their venture forward. So I think that's always been my favorite, and yeah, that's it.
I'm happy to go next here. Dina is a company that's been around for a little over 6 years. We bootstrapped for the first 2 years and then have gone through a couple of rounds of financing and recently just completed our Series A. So the day-to-day is changing, but I'm having a lot of fun right now. And if I was to summarize sort of what the role is, there's of course a ton of challenges, but there's a lot of variety in kind of the work. And I would sort of summarize it in 3 categories. The first is really tending to the vision. This is a really dynamic time in the industry right now. There's the emergence of telehealth and remote patient monitoring and really opening up community and virtual access to care. And so, tending to the vision is a full-time job, and making sure that the company has a true north around how we execute in the market. The second piece that I really spend a lot of time with is building team building. So with great resources that come to the table, whether it's adding new advisors or investors, or recruiting great people to join us on this mission of really helping people increase the number of healthy days at home. That's a lot of fun. You get a chance to meet some really talented people, both people who've been in the industry for quite some time or who are just starting their career. And so it's one of the more rewarding parts of the job when you get to help somebody really professionally develop and perhaps share some of the things that didn't work for you previously, and they can learn from that or otherwise create really great opportunities for them. And then the third area that I spend a good amount of my time on is execution. It's great to have a vision. It's good to have a good team, but you have to deliver at the end of the day, and you have to fulfill your promises to the people who really lean on you. And those could be customers or they could be other types of partners. But it's again, healthcare is a unique, dynamic, and sometimes complicated industry. And so you can't take your eye off the ball in actually delivering at the end of the day. And so having a lot of fun, but if I was to summarize my day, I sort of bounce across those three different parts.
Thanks, Ashish. I'll go next then. So in my role as a venture capitalist, I would say I'll also break it down into 3 buckets to simplify. The first one is sourcing. This means really being able to identify interesting companies that are really making substantive impact in the healthcare space, but those that also fit our specific investment thesis. This could mean anything from getting involved with Matter events, for instance, right? Since we mentioned that a couple of times, or meeting new other fellow healthcare investors, or attending different types of startup conferences to see what other people are creating and trying to build. So it can come in a variety of different forms. We're tapping into alumni networks. The second piece of it has to do, it's a broad bucket of diligence. So let's say you've identified a couple high potential startups. Then after that, we would do an initial deal review to see if this is initially going to be a good fit. And then if it is, we would progress into much deeper due diligence. So that includes everything from taking multiple diligence calls with the founding team, speaking with their different customer sets, really digging into their financials, etc. And then the last piece is after we do make an investment in a company, we do post-investment portfolio company management and support. So this is the part that personally I get the most excited about because this is where you're also working and collaborating with the entrepreneurs to provide support and help them shape it. So maybe this means introductions to new customers, or if the company is raising the next round, how can we bring on board other investors to help them out? Or perhaps the company is thinking about making a business pivot, right? Because they're realizing that their old thesis was not quite working out. So it's time to be nimble and make a pivot. So those are all different ways of what I mean when we say we collaborate with those entrepreneurs. So to recap, in VC, it's really about sourcing. It's about diligencing companies and then doing post-investment portfolio company support.
Thanks, Dana. I'll close out this question. I would say that depending on the stage that a startup is in, the early few end up doing a lot of different things. And so, Savona is in its very much infancy. And so a lot of my time is spent on thesis, like what is it that we're going to go do? And I spend more than half my time testing the thesis in market, talking to who my ultimate target customer is going to be, how they react. So that's kind of one big piece of work, is just thesis development and market positioning, and that evolves, right? That's very fluid early on. Another big piece is keeping the lights on, right? You've got to find a way to pay bills, and that's fundraising, that's passing hats around, that's bootstrapping, all the fun things that you have to do. So there's always that element of how do you get through the next couple of months that's on our minds. And then the third element is everything else that a business needs to do to stay afloat, right? You gotta pay bills, and you gotta have a website, and you gotta have a bank account and a tax ID and all this other stuff that has got nothing to do with healthcare, right? So those are probably the three big buckets. And then, as you grow, all the things Ashish mentioned become very relevant as a leader, in many cases across any industry. And then the unique elements of that is, what is your thesis? What is your vision and mission? And how do you stay true to that? And I think I can echo all of those sentiments. So.
Yeah, perfect. Now that we've learned a bit more about each of your roles, I'd love to move a bit more into predictions and trends per the title of the event. So a few of you mentioned and really touched on, it's a very dynamic time, obviously within healthcare. The pandemic created unforeseen challenges and demanded a lot of innovative solutions. And so something I think a few of you mentioned is the role of telehealth has been really important throughout the pandemic, and it's played a really important role in healthcare delivery. And so my question to you guys is, post-pandemic, what role do you envision for telehealth? Do you see telehealth as something that is here to stay? And what do you see as potential limitations to continuing to rely on telehealth? I know those are a lot of questions.
I'm happy to get it. I think I'll probably, I just want to acknowledge that, yeah, I think telehealth first and foremost is here to stay in a major way. Now, I think it's going to evolve. There's an aspect of creating access to a whole number of services that perhaps were limited to a physical location. But if we could put that off to the side for a moment, I think in terms of a major prediction of what I think will happen here moving forward is healthcare is coming home. And it's a lot of, what we focus on as well. But this idea of a hybrid infrastructure that talks about how do you create access through telehealth, continuous monitoring of your health and well-being through remote patient monitoring capabilities, but in conjunction, how do things come to you? You're seeing massive investments in the space around mobile lab testing, mobile urgent care. The house call is coming back into the home. If you think about those who are seniors or more so vulnerable, access is an issue. And I think we could solve a lot of problems by bringing things to you, much like you receive a package from Amazon or your favorite, commerce site coming to your doorstep. Healthcare is now increasingly being organized in a way where it's being deconstructed from the physical locations and being brought to you on demand. And that's playing into, I think, what consumers want. They want convenience at the end of the day, and convenience has been signaled as a driver for quality and then actually getting costs under control. So I think as excited as I am about telehealth and remote patient monitoring, the in-home delivery ecosystem is starting to really get organized in a really compelling way. And so I'm excited to see that happen. When that infrastructure is in place, I think we're going to have this concept of a virtual primary care clinic in every single home everywhere, where you're able to sort of, again, interact with a multitude of services. And I don't think it's a matter of if, it's a matter of when that really becomes pervasive.
So I'll add on to this. I agree largely with Ashish's sentiment that a big part of telehealth is here to stay. I think we've seen a lot of those benefits. Maybe to add a different dimension to this conversation, I would say, what are some of the caution areas, right, to consider, right, into the future? Number one, we know that the regulations were loosened during the pandemic. It's probably not going to stay like that forever, right? So reimbursement and how financial incentives are going to work is something to watch out for. Secondly, telehealth by nature requires that you have the right kinds of technologies and access to broadband access. Does everybody have that in the US or other regions? Not quite, right? So we're seeing that disparity of health equity and access to care coming to light more. So what about people who maybe come from low income areas or in rural regions where they don't have internet access? That's another issue that we are still working on resolving, and there are companies working on that too, but we haven't totally cracked that. And then the third piece of it is thinking about care continuity. So for instance, if certain patients do have telehealth visits, are all the notes and comments from that consultation successfully being tracked and also passed on to whatever EMR systems they're using? That isn't always the case, even though that the ease of this visit to happen might be improved. So all those little elements, I don't think that they're showstoppers per se, but they are part of the logistics that we need to think through if telehealth is going to be here to stay.
Yeah, I'll add some. I think, Dana, those are great points as we think about, to Ashish's point, I think telehealth can be viewed in a very narrow scope, which is we're taking visits that were episodic and encounter driven and just moving them out of a hospital or clinic setting into the home or into the office or into the car over the phone. And I think that kind of visit is going to stay because we've gotten used to it through the pandemic and subject to some of the constraints that Donna mentioned, where if no one reimburses for it, it's not going to happen. So it doesn't matter whether it's convenient or not. And that's unfortunately the business reality of healthcare is the system behaves the way that economics are driven. What I believe is going to happen is along the lines of what Ashish was outlining, which I think we're at a moment where there's an opportunity to just rethink what we even perceive healthcare to be. And by that, I mean, we shouldn't really even think about telehealth versus in-person health, right? It should just be healthcare, right? And you may just be able to get served at home through a virtual visit. You may actually have someone come to the home to administer a visit, or you may end up having to go somewhere for a certain form of care. But I would almost view this unbundling that is happening, and Ashish's view of what's coming to the home and care in place is all examples of that. And I think that we're going to see a lot more of that. And then a virtual visit just becomes a form of care that becomes an option. So kind of the big, bold view that I think what things look like is we are going to see some really significant unbundling of services and a lot more consumerization of the consumption and ability to consume. I think it's a really interesting time, and I think the pandemic has maybe accelerated the awareness that this has to happen, but I think it's also the economics. I mean, healthcare economics are unsustainable the way they are today, and that's going to drive change. And doing things digitally and virtually and in place is a natural evolution, independent of cost, but you've got both of these factors piled on. So I think it's going to look very different in 10 years.
Yeah, I'll pull on that thread just a little bit. I think we all get excited about the promise of virtual care because our hope is that it will lower costs. But if I sort of put on my cynical hat to counter some of the optimism, when I started in long time ago, right, we all thought that strapping something on our wrists was going to suddenly make everyone in the country physically active, and we were going to solve the obesity epidemic by throwing technology at it. And I think it's important to remember that technology is a facilitator of things, but if you're putting that technology on a very broken system that doesn't know how to meet people where they are and serve their needs, then we're only going to go so far, and we may increase the costs rather than decrease the costs. I think Dana kind of touched on, who has access to these services. And I think there's some potential that, these tools don't redress disparities, but actually can exacerbate them. If all we do is identify that someone has a social determinants of health risk, but we don't actually have the tools and processes to serve and address those challenges for patients, then we're not really solving the problem. So I think we have to temper our enthusiasm for technology solutions with the data that shows they're delivering on outcomes.
Yeah, one of my first projects when I moved over to Yale New Haven Health about 2 years ago was to pick a telehealth vendor. And so we moved from one telehealth vendor to another. And I just remember, a year and a half ago, I was kind of like begging doctors and nurses to use their telehealth platform. And so it was a lot about education, a lot about process. And we had a lot of strategies to really sort of stand up our telehealth side. But then, the pandemic hit, and so almost all of our care was delivered virtually over telehealth. And so I think that, there's 2 points. I think that the other panelists have mentioned it. I think innovation is really the intersection of technology plus, regulatory. And so almost all of the innovation that we see today over the last 10 years have been sort of catalyzed by regulations and sort of, policy that really sort of, whether it be meaningful use or high tech, that really catalyze all the innovations that we see today. And so being a digital health optimist, I think this telehealth, really sort of acute hospital at home, these regulatory changes that are happening and informing, the pandemic informing policy, are really going to open the door for the next 10 years of digital health. And I'm just really excited to see the different types of technologies that are out there. But I totally agree with Kate that technology is not everything. If you put technology on top of a broken process, you really just have like a digitally enabled broken process. And so at some point we do have to sort of restructure these processes. And, I think at the highest level of acuity, oftentimes it's not the technology, but it's really the broad swath of services that you can provide, really sort of the patient. And so whether that be care coordination or sort of enhanced provider, but generally, very optimistic in the trend and direction that virtual care is going. And I do believe that we're in a moment of time that we're going to see great companies come out in the next 5 to 10 years.
Absolutely. I think, Kate, you brought up kind of the relationship between healthcare and technology. And I know historically, a lot of people have kind of voiced the idea that technology is not as integrated into healthcare as it could be, or as it should be even. So my question is, how has telehealth begun to redefine kind of the way that we think about the relationship between technology and healthcare?
Yeah, I'm happy to kick the conversation off. I'll just use some real practical examples of, even if you just look back over the last 12 months with what we've all kind of experienced together with COVID. Just speaking through an example with some of the work that we do in the Philadelphia market with Jefferson Health, for example. One of the concerns that they had as they saw COVID really rising the number of cases in that market, their team was naturally very worried about their overall capacity to be able to take care of all of those positive patients. And so one of the things that they talked to us about, and we were in crisis mode. I mean, we were around the table trying to say, what are we going to do to make sure that we're not overrun in terms of resources? And their team, to their credit, came up with really practical innovations. And they said, we don't have time for a complicated rollout of technology and change management and all these things. To use a really crude analogy, patients on the table bleeding, we got to find a way to sew that person up and move on. And so what they came up with was, I think, what you'll see a lot more of when you think about telehealth being connected with other capabilities. There were COVID positive patients that did not require hospitalization, but because of the stage, needed to be tracked over a 60 to 90-day period. And so what they did is they found a mechanism to use things like SMS-based, two-way SMS-based engagement solutions to reach people at home. And then based on their feedback, either route them to a live telehealth visit or sometimes a nurse would literally pick up the phone and call them, or somehow deliver self-care instructions. And to me, that wasn't remote patient monitoring, that wasn't telehealth, that wasn't traditional care management, but it was taking a few different ideas and really putting the person in the middle to say, how do we bring these things together? Wish it was our idea. It was really a product of like crisis management and the innovation that took place. But I think you're going to start to see a lot more practical things like that emerge. And to the other panelists' points, there has to be a reason for why you implement that. Obviously, we're in a crisis, but I think moving forward, people do need to be able to get paid for it. There has to be a business case for it. The one unfortunate thing is that provider budgets are really constrained now. So it's forcing the entire industry to really get specific around the return on investment or how they creatively price products around their innovation. So it's not just the technology. The innovation is going to be how do you actually bring solutions that everyone knows they need, but to market at scale in a practical manner. That is as much of the innovation as the other aspects of the technology or the delivery. So just a little bit of our experience over the last 12 months.
Maybe to shed light on a different angle, technology and healthcare intersecting. So this pandemic has made a huge impact on the biotech pharma space as well. Some 1,200 plus different types of clinical trials had to be paused or stopped as a result of the pandemic. It was not safe to be coming on site anymore. So the question is, what can we do to still advance the trials? Because these are drugs that we're trying to collect data on, get developed to treat a lot of unmet needs and diseases out there. And so I think what's interesting here, an example of technology being able to aid some of those gaps, is the use of virtual clinical trials or decentralized clinical trials. And all that jargon really means is being able to execute clinical trials through mobile means or telemedicine means. And this allows a lot of patients to either remain at home for most or all of the clinical study, whereas beforehand they had to go to a specific site. And this also allows maybe other people from areas where they could not conveniently travel to a site to now participate in a clinical trial, which also helps to alleviate, not solve entirely, but it does help alleviate part of the significant diversity issue that we see in clinical trials. So I just figured I'd bring that example in, how technology's intersection with the pharma and biotech industry to be able to help advance those gaps that we saw from the pandemic.
I think that point around access is an important one, you know, and in healthcare, that might mean some of the opportunities we're seeing in second opinions or specialist visits being more accessible for patients. So if you are a large health system with an academic medical center or large facility in an urban environment, you may have remote facilities in rural areas of the state or in other areas of the state. And historically, you know, you've had an unfortunate challenge for the providers, which is, you know, they spend one day a week or a couple days a month as a specialist care provider being sent to work at one of those other facilities. So when I was in St. Louis, you know, my colleague down the hall would be gone periodically to a hospital 3 hours away to cover their oncology service a few times a month. And I think that, you know, there is an opportunity with telemedicine to extend the reach of that specialty care in a way that may benefit health outcomes for patients in rural areas who tend to have worse health outcomes on a lot of different measures. So I think, you know, what you're hearing from all of us is some specification of pockets where telemedicine may really be able to provide some benefit. And I think that the opportunity is to find those pockets and build on them, because telehealth or telemedicine, you know, as a concept, I think is becoming increasingly commodified. And so the challenge is to find those opportunities where, to Ashish's point, the business model also goes with the technology.
Yeah, absolutely. I like Kate, I like your point about how telehealth has kind of been a way to bridge some gaps that currently exist in healthcare. And so another question I have is, And what other ways has the pandemic exposed flaws and shortcomings within our healthcare system? So other than like the telehealth issue and some of the issues we've discussed, I guess what other issues have been brought to light in the past year?
I mean, I'll start with, is just someone who works in public health and health communication. I think it's really exposed that we don't train people in health communication skills, and there are implications for that. I think for me, the great example is Civis Analytics here in town does a lot of work on messaging. And they've been doing some great work with the state of Illinois on how do we message around vaccination or COVID testing. And I think it's brought to light that, people will say, I'm concerned about safety as their reason for not getting a vaccine. But when you test messages with those individuals, the safety messages don't resonate. And so I think it's something that every patient care provider I've ever interacted with will say is, and I think Ashish pointed this out, people will give a shortcut reason when articulating, when asked, but that doesn't necessarily reflect what's going to drive the outcome and what you can change. And I think that concept that we've really seen amplified during this last year applies to a lot of settings. We see it in medication adherence, where patients will say, I just forget to take my medication. And what's underlying that is an ability to afford the medication, an unstable housing situation, lots of other root causes. And I hope that the exposure of that leads us to really invest more in thinking about health communication and population health strategies going forward. But I may be a little naive that that's going to happen.
Yeah, I will echo from my lens. I would say it exposed just massive number of shortcomings at a public health level for us as a country, and I think those are still glaringly obvious, right? I mean, if you just even try to understand and make sense of what's going on with vaccine rollouts, there's just no logical way to look at that as an engineer and as a technologist and say that makes sense. It just doesn't make any sense, right? It just makes no sense. And it's because it is so fragmented that people are finding ways to, like, I'm hearing that people are calling Walgreens and Mariano's at 4:00 because they have vaccines left over and they'll go to waste. It's like, what is going on? So I will just tell you that there's a lot of opportunity for technology to really make impacts to things that are just really not hard problems to solve at a technology layer. And they don't require rocket science, but it's a public health issue because we are super fragmented as a public health ecosystem, right? Like even within the Chicago area, like Cook County is doing its own thing and Kane County doing its own. So if I'm on the border, it's just, that to me is just, there's opportunity, right? And the question is, how do we go after it and how do we help people? And to Kate's point, if we can't figure it out, the chance of an average citizen trying to understand what to do about getting a vaccine and where to go and how to get one, it's a lost cause, man.
Great points by both Nirav and Kate there. We've talked about the system, we've talked about the patients and their experience. I think the other dimension to this that I'd like to sort of call out is really the provider and caregiving community. And so, I think nobody's in this space to try to create a messy industry. I think everyone is in it for many of the reasons that I think, Sam and Donna shared at the beginning. It is very personal for people why they get into this. They really, truly care and they're trying to do the right thing. But over the last 12 months, I think we've seen an overwhelming amount of people go above and beyond in terms of their hero sort of performance to try to meet the moment. And I think that there are going to be unfortunately, some unintended consequences of that coming out of the pandemic around burnout and other types of issues around quality. And for those of you who are not very familiar with the data as it relates to the healthcare workforce, there are massive shortages of nurses. There are massive shortages of physicians. It is a industry that is very driven off of labor, but we have short supply, and there's overwhelming demand if you look at the number of people who will need complex care management, for example. And so I think a focus on workforce productivity and making sure that there's proper training and that there's a proper opportunity to really nurture and develop people and not burn them out and churn them out from the industry, I think is going to be really, really important. I think technology does have a role there. And so to Kate's point around communication, or Nirav, your point around the logistics of it, I think we force people into this to act like heroes and have to work above and beyond for the things that really we should be able to help make their life easier so that they don't have to think about leaving the industry. I just can't emphasize this enough. We talk about the personal people experiences, but people who work in healthcare are really critical to a great experience. And so I think over the last 12 months, that's one thing that I've seen through our current customers, and something that, quite frankly, I worry about. I think there's an opportunity for us to help in that area.
Yeah, I would just add to what Ashish had said. You know, we're very sort of worried about our providers here at the system, and so I think the failing that we see is that we just don't have the tools or the mechanisms to really support them. You know, we think that mental health is definitely sort of the parallel pandemic that's happening in our country today. On the provider side, it's just the psyche of the whole community. So really the dearth of mental health tools and providers, it's really just been sort of exposed, and perhaps that is a public health issue. But I think that at our system, we surveyed all of our administrative and clinical staff, and almost 3 out of 5 of our providers demonstrate symptoms of acute stress disorder, so very similar to PTSD. And so it's been a trying time, and I think that everyone has displayed great strength, but to really sort of what she said earlier, our leadership has said that everyone's working twice as fast, but COVID has been sort of an exponential problem, and so we were never really able to catch up. And so I think that with communication, and so also just decencies, our coworkers, we don't have the tools right now, and we're providing some mental health counseling services to our staff, but that's booked out until June or July. So if we need it, we're not unable to really sort of support our caregivers. But I think that from an administrative perspective and from an innovation perspective, it's we're trying our best to give everything that caregivers need, whether that be PPE or sort of first sort of access to vaccine, to really support them to do their jobs. And I think fundamentally, all of us on this panel really want to support these entrepreneurs and also our caregivers to do the best job that they can. So whether that be technology or process, but totally agree with Ashish and sort of the caregiver plight that we're seeing today.
I'm going to make my comment real short, but I just wanted to say, given all the buzz around people wanting to invest in SaaS companies and healthcare SaaS companies, I think one thing to remember is technology is great for facilitating and for increasing efficiency, but at the end of the day, it's healthcare services that are being delivered that saves lives. And that's one of the reasons why at OCA, we invest not only in SaaS companies, but we also want to look at healthcare services companies as well. So for folks that are interested in investing in healthcare companies, just remember that tech only gets you so far. You have to be able to have the service to also deliver that care at the end of the day to actually reach and deliver it to that patient.
Absolutely. I think these are all great points. And so kind of bringing the discussion back to each of your organizations and each of your roles, in 2021, what do you see as the biggest challenges facing your respective organizations? And how do you feel your priorities as an organization have shifted in the past year?
I can go first. I think that, we're at a time where we're just picking and choosing these new technologies to integrate into our systems, and sometimes that implementation time is going to take 12 to 24 months as we really think about hardwiring this into our clinical workflow and sort of changing our clinical practices. But from a 5-year perspective, I'll just say that the health system is a classic incumbent. We're never going to be able to move as quickly as sort of the market, and sort of the work that we do in terms of digital transformation. It's going to really be difficult for us to outpace all the great innovators here that are really trying to make our processes better, make clinical care more personable. So at the hospital, we do really, we're really great at treating the patient when they come into our 4 doors. But as we sort of think about telehealth and hospital home, perhaps there's not really the financial incentive to move over and deliver that care. And so I think that's going to be an impediment for us to really sort of move quickly and at pace with the rest of the market. But I think also just in terms of, I think Ashish mentioned earlier, our budget is very constrained. So in terms of our finance and moving some of these digital transformation efforts forward, we have to be very careful about which projects we could choose this time. So a little bit more sort of careful and sort of have to pace ourselves. But those are a few of the challenges that the health system is going to face sort of moving forward.
I'd say, given where we are in our life cycle at Savona, 21 for us is really getting some strong validation of our thesis in market and closing some funding, right? Like pretty simple goals when you're as early as we are in our life cycle.
Nirav's point about market validation, I think, is very on point. Because for actually several portfolio companies, even though they've gone through the customer discovery process, they think they figured out product market fit, one thing we continuously encourage our portfolio companies to do is, well, you should be revalidating that. Just because the market was like this last year or 6 months ago does not mean that's the same thing today, 1 year, 5 years down the road. So you should continuously be getting into touch and have kind of the customer discovery hat somewhere that you're putting on from time to time. So we actually have encouraged and seen our portfolio companies continue to validate exactly what customers actually need and how that's evolving, especially as the healthcare market is also changing.
I'm happy to sort of share, in terms of 2021, such a different year from last year, but I think, our focus is on, the market is very dynamic. So we're spending a lot of time on thought leadership. To Sam's point, people know that they need to take action within health systems or health plans, but they're not yet ready to quote unquote buy or implement. Sometimes it's bringing the prospect along and providing education. So we're focusing quite a bit on thought leadership. To my earlier point around execution, a lot of work around execution, team building. If I look at what we've done over the last quarter and a half, we've onboarded close to 15 people, which is a lot for an organization like ours at our size. So just continually looking for really great people who can join us on this journey and make an immediate contribution. And then, just kind of take a slightly different approach from just in terms of just the blocking and tackling. We're working in a hybrid or virtual environment. And just to my earlier point around providers being burned out, I think this is all new for all of us to work in a new world of Zoom or Slack or other sorts of platforms. And so just trying to stay really close to all of the people within our organization and designing and evolving our culture to fit what the world looks like today. That's something that we don't take for granted. So, more than ever, we talk a lot about our values. How do we demonstrate them? How do we stay connected while staying safe and trying to look into a crystal ball and figure out what does the summer, the fall, or 2022 look like? Is easier said than done. But, our approach internally is just to try to maintain an honest and transparent, continuous discussion around that topic. I, for one, would love to be in a group gathering one day with all of the people in our company, but we're trying to figure it all out as we go. So that in and of itself is a challenge for us.
Yeah, I'll just echo some of that. A year ago, I watched 3 projects I was scheduled to start in the spring, evaporate as everyone, to Sam's point, said pause. And that's, started to pick up. But But I think people are proceeding with caution. A lot of folks had some significant economic impact, and I think there's also just some uncertainty, right, around the regulatory, around the business models, and how those are going to shift. And so I think, it's a time where people are, we're seeing more jobs get posted and people hire, which is great for everyone who's about to enter the job market upon graduation. But I also think, I'm not seeing people take big leaps of faith quite yet. And really, we love to talk about transformation of healthcare, but a lot of, small steps right now versus big leaps.
Absolutely. Thank you all for sharing your perspectives. I think that we're running a little short on time. I think I'll ask just one more quick wrap-up question. So the last question is just, what advice would you give to a student who's potentially interested in pursuing a career in healthcare?
All right, we'll do the 15-second round here. I think that it was mentioned earlier by a variety of the panelists. It is a very, very broad discipline. So whether you love technology or you love taking care of people, and your heart is tied to actually being in patient care, there is a role for almost every discipline in healthcare, all the way from designing equipment, like if you're into mechanical engineering, or taking care of people because you're into biology or psychology. I mean, there's just, I can't think, it's, if you're into finance, I mean, there's a lot of breadth in healthcare. So I would, having come from another industry, I would recommend it highly, because there's just, you make a real impact on the lives of people, no matter where you sit in the ecosystem.
Happy to chime in next. Yeah, there's a world of opportunity there. One thing to think about as you're pursuing any kind of role in healthcare is asking, who's the actual decision maker, who's the user of healthcare, and then who's the payer? Because oftentimes, at least in the US healthcare ecosystem, that could be 2-3 totally different stakeholders, right? And so always be asking that in your head as you're trying to figure out how this very complex and messy beast is operating. And also, no matter what kind of role you take, whether it's with a health system, maybe it's with a pharma company, maybe it's with a digital health company, just realize that you will be directly or indirectly tangentially touching all the other aspects, because it's like a intertwined system. Like if you're working for biotech, for instance, you have to know how the payer landscape works, because you got to sell the drug, right? And also the providers are the ones that prescribe the drug. So even though you're at a biotech firm, you'll still be indirectly learning about provider landscape and also the payer landscape as well. So just pick and choose what you like, and you will gradually get tangential experience with the other aspects of the US healthcare landscape.
I'll just echo that and say, there's so many places to have impact, and we've talked about choosing because you have impact. And so just as important to look for an organizational size and a team that you love working with. You can be at a small startup, you can be at a behemoth, Fortune 5 company and still be in healthcare, and your day-to-day work experience will feel really different. You can be remote work and, always remote, and you can be remote work today, hoping like Ashish, that you're going to be back in person with your team as soon as possible. And there are really important quality of life elements to those things. And so, I've had the opportunity to work on a lot of teams, and I've adored some of them, and some of them I am glad we no longer work together. And that's part of finding a job too. And just remember, if your first go at it is not the right size company or the right team, it doesn't necessarily mean healthcare isn't for you. Keep going.
Yeah. I think great advice from everyone. I think the one thing that I'll just be really quick and add is more general advice coming out of sort of your current education is don't be afraid to go deep into an industry or vertical, whether it's healthcare or energy, education, or another one. I think going deep on understanding how that industry functions can serve you in many, many ways. while in parallel going deep on what you're most passionate about, whether it's finance, engineering, product, you name it. But those two things together start to create an unfair advantage for you professionally as more and more time goes by. And so go deep in an industry, go deep in what you're passionate about in terms of skill set. I think those two things will serve you really well.
Yeah, to all the students, healthcare needs a shot in the arm, and we need new technologists, we need new leaders, we need new providers, we need new caregivers. You know, healthcare is very mission-based, and if you're really sort of seeking a career or vocation that is really special, I think healthcare is a really personal and mission-based line of work. And so I just think that we need this new crop of talent to help us build the healthcare system or healthcare environment, kind of moving forward. So I think it's a really sort of rewarding vertical as well. And so just to really sort of, as a provider, be able to really sort of change someone's life through healing. And so on the administrative side, really sort of, help, the care deliverers really sort of deliver their care. So really sort of great opportunity for you to grow. And it's a massive industry with lots of different sort of nooks and corners. So I really invite anyone that's interested in healthcare innovation, happy to sort of also chat with anybody and give my perspective. But yeah.
Big thank you again to all of our panelists. To our audience members, I invite you to now head to the main stage for the Startup Symposium virtual career event. In order to get there, you can just click the stage on the left-hand side. See you there, and thanks again for attending.
Thanks, Lisa.
Thank you for
Thank you.
having us. Cheers.
Bye.
Thanks. Bye.